Welcome. This is Dr. Julie Marfeld, Dean of Nursing at Frontier Nursing University. I'd like to welcome you to a segment of the digital summit that we are having for Nurse Practitioner Week. We're focusing on stories and everyone's stories, and I'm very fortunate this morning to have three of our current DNP students with me to tell us their story about how they chose Frontier, why they think doctoral education is important, and to talk just a little bit and showcase their projects and where they're at in it. So I am joined today by Cara Jefferson, Nikki Ernenbusch, and Sid Markman, and I'm going to give them the opportunity to tell their stories, and we're going to start with Sid. So good morning, Sid. We're here. It's 9 a.m. here. I don't know what time it is in your neck of the woods, but I think it's a lot earlier than that. I'm thinking it's maybe 6.
Yeah, that's right. It's 6 a.m. here in sunny Puyallup, Washington. My name is Sid Markman, and I am a student in DNP 20, which means that I graduate on December 14th at 8 a.m. So I'm getting used to these 8 a.m. times, these early times.
So, Sid, if you would, I would like you to talk a little bit about why you think DNP education is important and why you chose to come back for your doctorate at this point in time.
Thank you, Dr. Marfell. My story started several years ago, actually. I began thinking about a project that I wanted to do. I've been involved in sports medicine for several years and with concussions. And what I noticed with concussions were that kids couldn't get the care that they needed when they needed it. And they often had to travel for long distances. So I started thinking about how I could do this, and I realized that I didn't have the skill set that I needed as a master's prepared nurse practitioner to make this happen. And why I think a doctorate, so I started doing some background information, and what I realized was that I needed some steps in place. I needed research pieces. I needed quality improvement pieces. I need more evidence pieces to put together the program that I wanted to do. And I'm so passionate about becoming a doctorally prepared nurse practitioner. When I look at how I practice and what I do things, how I do things, it's just so different. I look now at the evidence. I look at the steps. I look at the world differently as a doctorally prepared nurse practitioner. I look at the processes in place. I just started a new position, and I had a interview last night with the director, and I said, we need better processes. We don't need to be adding staff here in the emergency department. We need to be adding staff at the other end in the urgent cares to stop the flow to the emergency department versus having to add staff at the end where we're already jam-packed with people in rooms. And that understanding and that education is something that came to me from the doctorate program.
Excellent.
Yeah. Thank you.
Oh, thank you. Nikki Ernenbusch.
Yeah, my name is Nikki Ernenbusch. I'm in rural Montana, and I guess that how I decided I'm actually a recent graduate from Frontier too. I graduated in January 2015 with my master's in family nurse practitioner, and I started right away in a small community health center, and I was in the job very, very briefly before I was handed the title of medical director as well. And when I took that role, as I said, basically without a choice, I was the one that was the most qualified. And but when I took the role, I realized I really did not know how to function in that role. And I applied and decided that I'd better work on my doctorate as well, not only to learn that role, but also to, at some point, I do hope to become a teacher at the master's level as well. And so that is how I decided to to do the doctorate in nursing and in nursing practice, mostly to currently to excel in the role that I have. And as Sid has said, I look at our processes in this clinic in a whole different way than I used to. Even though I was new to the role, I now, any changes that I make and anything that I ask other people to consider, I always tell them we have to look at the evidence. No more just guessing what will work. The evidence will lead us to the right spot in a much more organized fashion. So I strongly encourage everybody to pursue the doctorate in nurse practitioner nursing practice. I just think that nobody will be disappointed that they did. That is my story.
Great. And Cara Jefferson?
Hi, I'm Cara Jefferson. I am from New Iberia, Louisiana. I guess I'm a combination of both Sid and Nikki in that when I graduated, so before I even became a nurse, I was a 7th grade science teacher. So I always wanted to go back to teaching. And now I work primarily in urgent care and emergency medicine. Even though I did that when I first graduated nursing school, my primary passion was actually cardiology. So to make a long story short, with my project, my focus is on EKGs and cardiac abnormalities because I have that passion for it. And so the reason that I did the DNP was because I realized that we have this void, especially when it comes to sports physical exams in our kids and heart problems, and I felt like I needed to do something about it. And it was like we were kind of going through the motions. Everybody does all these little physical exams, but what were we really doing? What did the evidence say? So the doctorate of nursing program makes me kind of the expert in my practice wherever I work to be able to make a change for maybe not necessarily just a high school or middle school athlete, but anybody that I come into contact with. And through the Doctor of Nursing Practice program thus far, I'm able to see how important quality improvement and quality assurance is. The evidence is so important because without it, you just have no idea where you're going, and you can't really lead people if you're not following the evidence.
Well said. Well said. I tell you, we have the greatest students and graduates, my opinion. I'm biased, but that's okay. So I'm going to ask another question and again start with Sid. So why did you choose Frontier, and what are some of the things that have helped you as a doctoral student here at Frontier Nursing University?
Oh, thank you, Dr. Marfell. I chose Frontier because I wanted a program that not only met my needs in terms of time and travel, but more importantly, I chose Frontier because I wanted to do a program. I wanted to do a distance project. I wanted to do a project where I learned about health inequities, and I was designing a system for health inequities, and Frontier was for me, it was a natural extension. Frontier understood that not everybody got care by having them come to the doctor. Mary Breckenridge started the program. I always tell people she started the program with the 5 outposts around the main school, and the midwives went to the people, and this program that I was designing was going to the people. So to have a school that understood that and understood that healthcare isn't where the doctor or the nurse practitioner or the provider is located, but where the people are located, to me made the most sense. And then the other question a lot of people ask me is, well, how do you connect with your faculty and your peers? And I tell them my faculty and my peers are literally an email away. We connect almost on a weekly basis. Definitely when I was younger in the program, we connected on a weekly basis via various social media like Google Hangouts and YouTube Live. And then, my classmates I connect to on a daily basis. They're literally usually the first people I hear from in the morning and the last people I hear from at night. They're always there. We're always together. I'm probably more, I definitely am more connected to my classmates and my faculty than I was in my basic nurse practitioner program at the University of Washington, which is an hour away. So to me, Frontier, it understands the kind of healthcare that I want to deliver and the kind of healthcare that I think is really important to understand and deliver as we redesign healthcare in the next few years. So,
excellent, excellent. How about you, Nikki? And I'm just going to say Nikki is in rural Montana and is not able to be seen this morning because she's got some internet issues, but she's here on the phone. And Nikki, I'm going to ask you the same questions. You know, why did you choose Frontier? And tell us a little bit about your experience. And it seems like you're able to connect even sometimes when everything's not perfect on the other end. So thank you for being here this morning.
Yes, well, thanks for having me. And you know, as I mentioned earlier, I started my advanced practice nursing through Frontier in 2013, I guess, and I fell in love with the facility at that time, or the program at that time. That Frontier, we were told right away at Frontier Bound that Frontier, once a member, you're always a member. You have a strong Frontier family, and I cannot agree more with that. I still am in contact with my original roommate from Frontier Bound, and you know, I haven't seen her since then, but I know we could get in the same room and have just as much fun as we did when we were there originally. And not only with my peers, but as Sid said, with the staff too, and the instructors, they've all been just absolutely fantastic and have I feel my education at the top of their priority list, and I just cannot say enough about Frontier, and I talk to people all the time about going to Frontier. I encourage people to apply there. I think it is a great facility. I like that my original draw to it is I think that the history. I still tell people Mary Breckenridge's story. I think it gives me goosebumps when I hear it, and I like to tell it, how she went out to the mountain people of Kentucky. And I grew up in a very, very remote area in Montana, about the same size of town as Hayden, actually maybe a little bit smaller. And I have always felt that her passion and basically when you see a need, you fill a need, and that's the education that I feel like you get at Frontier is not only very strong and professional. It is for the people, for the patients that you care for. And I in the DNP program, the instructors that we primarily have, they care so much about us and our projects, and always give us nothing but support. And I will continue to, even when I'm done now, I'm actually contemplating the psych nurse practitioner program just so that I don't have to leave Frontier just yet. So once a member of Frontier, always a member. I strongly believe that, and I'm so glad that I found that program.
Oh, that's wonderful to hear. Thank you. We are very proud of our alumni, very proud of our students, and you're both. And it sounds like you're going to be around for a while, which is great. We like that too.
You can't get rid of me, apparently.
Well, that's all right. And, you know, being in rural Montana, I'm sure you have a need for psychiatric mental health because I doubt if you have much access. Yeah, go ahead.
And my facility, or my job that I work right now, I probably am caring for the population that I care for. Probably 75% of it is psych anyway, or mental health, and I feel like I need to be better prepared to deal with the patient that I already have. So yeah, I'm seriously considering that. I might take just a little break between though.
Oh, that's all right. We're not going anywhere. We'll be here. We will be here for you. Kara, how about you?
Well, Nikki, it's funny because when I talked to Sarah, my advisor, the last two times that I talked to her, I actually talked to her about the psych mental health program too. And
Well, let's do it together.
I know,
Great.
but I told her, like, I really need a break after this. I definitely will need a break. But because it's such a huge need in the country. And there's just a lack of mental health providers. But the reason that I originally chose Frontier, I had actually never heard of Frontier prior to discussing it with one of my friends who's now a faculty member here, Amber Littlefield. And she went on and on about how great Frontier was, how the instructors were really nice and willing to work with you, which is a completely different thing that I actually had in nursing school. It was like in nursing school, it seemed like they just hated you. But here, so after Amber talked about it and how she didn't feel like she was belittled, she felt like she was part of the family, she could ask, she could communicate, she could do any of that, I was like, okay. So I looked into Frontier and I came. One of the other great things about it for me was I'm a very self-directed, motivated person. And so I didn't want to be in a traditional classroom setting. Just like when I got my master's degree from the University of South Alabama, that was a distance program as well. And I find that I do better working through stuff on my own time. So that was really great. And what I found from actually being a student at Frontier is that, oh my gosh, y'all have the best instructors. They give you their cell phone numbers. They tell you to call anytime. It is like, it warms my heart. It's fabulous. So I love it.
Wow, thank you. I'm going to make sure the faculty watch this too because they are fantastic, and it's wonderful to hear that you all say that as well too. It's always
They mean it too. They've always been there. Anytime I've sent a message, they'll and say, "Hey, I have a question." They're right there.
yeah. Oh, that's one of the reasons why I think we've been very successful and why we have such great students is because we have great faculty. Absolutely
Yes, the
wonderful
faculty,
Absolutely.
they want you to succeed. And I think that's the most important thing. When you have people behind you who are encouraging you and they're like, no, you will get through it. We will get through it together. It's a good feeling.
I have to agree. I think in a lot of programs, it's a one-way road. They're giving you the knowledge. At Frontier, I feel like the faculty are there to support you and build you up. And I've never felt like that I'm gonna be dropped. I've always felt supported in my ideas and in my learning process. They want you to. There is no failure because they're going to catch you and push you and make sure that you get the information that you need to be successful.
Yeah, that's good to hear. That's our mission. Go ahead. Nikki, were you trying to
Oh,
talk?
no, I was just going to say absolutely. That's the way I feel. Sometimes, there's a lot of drive with them too, but they want us to get everything, think about every angle, especially with these DNP programs. There's sometimes I think that there's been almost frustration because I feel like I'm on a good path, and then I realize, oh my goodness, there's so much more to think about because the faculty has helped me look at every angle that I need to be learning from, and so the drive there, like I know for a fact they would never let us down and never let us fail, but they do drive us to better our projects all along the way.
Yeah.
Yes, and they give you a completely different way. So my train of thought could be one way, and especially like with Diana Jollis, like I'm thinking one way, she's thinking a completely different way, but after talking to her, I'm better able to engage and I'm more open. So I'm more open-minded about the way that she views stuff, and I can view it from the different perspectives, which is new for me, I guess. Some of us are set in our ways, but
Yeah.
it pushes you to be able to think critically in a different way than I did before.
Sounds to me like we're doing our job, and that's great. It's really, that's one of the things I know has been said many times, and that's what doctoral education is about, is to be able to help you expand and strengthen your thinking, to be able to open your mind up to look at all angles and all kinds of literature, and then be able to process it and put together a plan to be able to implement whatever it is that you're planning to do. So I'm going to ask you all briefly just your elevator speech about your project. So I'm going to start with Sid again, if that's okay. Just
Sure. My project, like I mentioned previously, I have had a background in sports medicine. And so what I realized was that there was no resources available for providers and for athletic trainers and for athletes and their parents for concussion management. So I designed a telemedicine system for concussion management that is a small pilot project, but eventually I'd like it to be sort of like a poison control hotline for concussions, that you can get virtual assistance, just like we're talking now, via the computer. I worked with 28 athletic trainers and saw, I think, about 30 kids, my final number, virtually in the training rooms and in the on the field, actually twice, to assess their concussions, and showed that instead of having to have kids wait a week or two and go through primary care and go through several days of waiting, we had kids either in the clinic within 2 days or virtually on the field right when the trainer needed them. So it's been pretty exciting.
Oh, it's very exciting. So that's just, it's again addressing a really big need right now, and doing it in a very innovative way as a nurse practitioner. I mean, talk about a story to inspire. I think there's one right there. It's just
Well,
fantastic.
I get it from Mrs. Breckenridge. She's the original disruptive innovator.
Absolutely. 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 Nikki, how about you?
Well, I am in the implementation phase of my project, and my project, as it continues to evolve, takes different routes definitely from where I've started. I am actually doing increasing provider awareness and education to patients in obesity management in adult patients. And the reason that I chose that is, well, first of all, I looked at my clinic and what do we need, and when we look at our little report card with the UDS measures, where we were failing the worst was managing patients who are overweight or obese. And so I went to the research and discovered that there is unfortunately not a real good way to manage people who are overweight and obese. And so, like I said, the program, or my project, continues to evolve. And when I looked at my clinic in general, the biggest problem is that none of us wanted to talk to patients about their weight. It's a hard thing. It's a very sensitive subject, and I've been kind of failing in a lot of different things that I've implemented, and finally in this third week I found a route that has clicked with providers, staff, and patients. So I'm actually pretty excited about it. And it's just a simple form of that assesses their readiness for change, and just opening that up has really actually made my project come right along. So while it's not quite as involved as doing a telemedicine for concussion, which I think is absolutely fantastic, this is a huge problem in the United States and the world right now, and it leads to a lot of other problems. And I think it's something that at primary care, this is where it needs to be managed. And so I think that in the project itself is going to definitely make a difference in in how I care for people and how my clinic cares for people. So I'm pretty excited about, like I said, this week the data is starting to show that we have some success. So that's awesome.
And that's what rapid cycle improvement does, is you have to keep going through to see what clicks and what works, correct?
Yeah, absolutely. So the last phase that I did, nobody was comfortable with it. Even I wasn't comfortable with it. It was pretty funny. I picked out a rep that I thought was going to be great, and then when I tried to implement it with patients, it was completely awkward. So yeah, it is. That's exactly what it is. And then you move on. If it doesn't work, you change it and move on. So yeah.
Yep. Well, again, I couldn't agree with you more. Being able to do that and make a change that way is going to have a big impact in your community. Big impact. And as providers, I agree with you. It's been difficult. That's what the literature said too, to be able to approach it. So it sounds like you are going to have a big impact right there in Montana, and also probably on a larger scale once you're done and can put out some of your data and publications and presentations. So
Yeah.
great work as well. Great work as well. And Kara, how about you?
When I started my project, actually, the urgent care that I work for, they were trying to decide whether or not, since we do all these sports physical exams, whether or not we should be including an EKG or not. So actually, when we first started, my project was mainly supposed to be about whether or not to include EKGs in the sports physicals. But all of the evidence, with the exception of the Italian study, says, no, we really shouldn't. And I actually talked to somebody at the University of Washington for one of our school projects. It was an interview, Dr. Kimberly Harmon, who said, even though the guidelines specify that EKGs are not necessarily the standard practice right now, or what we should be doing, based on the American Heart criteria and everything else, it should be something that we should consider. So my main thing with my providers at urgent care was to really increase provider knowledge, because prior to this, they were excited about the possibility, but they never knew that actual guidelines existed about sports physicals. So my project is actually creating a standardized checklist for all providers to use when they perform pre-participation sports physical exam screenings, and then kind of decide, when we have to refer somebody, we've decided to offer a free EKG with that before we refer them to cardiology, because we don't have the big sports medicine program that SID has or anything like that. We're a little bitty small town, but my providers have been pretty excited about it. And it's been like, they were excited about my project from the beginning. I think I just had a little bit of trouble trying to get them all on board and using the checklist. But after we ironed out the difficulties while we were exercising last week, I think we finally got it where everybody is 100% and everybody understands the importance, and they're really excited about it.
Again, what an impact. Not only in your community, but then with a good publication following it, presentation, big impact everywhere. Because as nurse practitioners, there are a lot of sports physicals that we do, and there's always a lot of question about, you can read the data, you can follow the processes, but I think every state is a little bit different, and to again have that literature out there and know that this is what is to be done and this is how it works and this is how to implement it is extremely important. And I think it's wonderful. And unfortunately, you hear of kids having problems on the field, not only from concussion, but from cardiac events as well. And to be able to prevent that, they die. Yeah. But to be able to prevent that.
I think
priceless.
It's because they're not being screened properly. You can't do the same basic head to toe physical exam without focusing on certain cardiac things. And that's what my project is geared towards.
Yeah. Wow. That's all I can say is wow. You guys are doing great work. I hope your stories will inspire those who view this video, because they certainly have inspired me. I'm very proud of all the work that you're doing, and I glad to call you students, proud to call you students, going to be prouder just because you're going to be done and be alumni. I don't know how much prouder I can be because I'm pretty proud right now, but I know you guys will all be relieved and be done, and we'll be calling yourself DNP graduates and doctor, and it's very important to move forward with this. So I'd like to remind everybody that we do have a DNP program right here at Frontier, and if you're interested, please go to our website at www.frontier.edu. If you click on the admissions section on the website, it will lead you through all the information about our program. And I again want to thank our students today for spending some time with us, and thank you all for watching us.